My name is Dr. Lynne Reid. I'm the lead medical educator for the Cairns Coast region. I work in GP and I work in a place called D Health, which looks after a very underserved part of the community here in the outskirts of Cairns. Okay, so originally I trained in the UK, predominantly initially in Scotland, and then also in the southeast, southwest of England. So I started with very broad training in general medicine. I did intensive care and anaesthetics training and additional internal medical training as well. I think it's the registrars who really want to exceed and stretch themselves. Getting this additional training in internal medicine will make you sort of highly skilled and a real developed sense of diagnostic skills, but also even being able to further interpret and take care of patients and their illnesses. I think this will be for the registrar who just wants to push themselves that bit further. Doing advanced rural skills training, so an ARST through the FAR GP pathway, you could do that in internal medicine, giving an extra 12 months of that additional training. ACRM would be doing an AST, an advanced skills training, and again giving you that extra 12 months in a sort of secondary care setting where you're doing a bit more general medical clinics, inpatient care. You're just in that sort of advanced care of these chronic conditions. So certainly for the RACGP, it would involve you doing a project, and I think that's a really reasonable thing to do. And during the year, obviously keeping up to date with your medical educator, your mentor, being guided through that year. When it comes to ACRM, I'd say you do have additional modules to do, but also importantly you have the additional STAMPS exam, so the Adult Internal Medical STAMPS exam. You know, most employers will look at that as someone who's really added value to their training, who's built on an already good foundation and framework, but added to it with that extra level of skill and expertise. So most employers would look at advanced skill training in this area as a real bonus. The registrars can expect to be really immersed in adult medicine. The idea would be that you get lots of access to outpatient clinics so that you know how to really manage the complex cases. So these are patients that have been deemed to need escalated care. Oh, I just loved adult internal medicine, just to get in the scope and just gaining the confidence to know that you can manage almost any situation, and even really complex patients with lots of comorbidities don't faze you once you've done that additional training. It gives you that sort of, I think, edge when it comes to sort of progressing your career, but also sort of standing on your own 2 feet when you're fully qualified. Having done this additional training, for me, it gave me confidence. For me, it allowed me to sort of take on most, if not all, of the presentations that would come to me, either in general practice or in other healthcare facilities. To convince a registrar to sign up for advanced skills training in adult internal medicine, the big sell is this is going to make you the best possible doctor you can be. You'll be the safest pair of hands that you could ever want to be, whether you are in general practice, whether you're in a regional or rural remote setting. Doing this additional training will make you the best that you could possibly be. It'll give you a breadth of knowledge you'll not get anywhere else. This is definitely the one to do if you want to be the best at what you're going to do.